So if you're only missing one tooth, why a dental implant over a proven traditional bridge?
So bridges, they are still being used. You know,
Okay.
there's definitely a time and place for a bridge. However, with dental implants these days, you know, it's more conservative, right? You're not shaving down 2 other teeth next to that gap that to replace that missing tooth. So essentially, you're leaving in a 1-tooth problem. You're not making a 1-tooth problem into a 3-tooth problem.
Okay.
And you know, in the long run, what ends up happening is it's more difficult to clean with those bridges because the teeth are connected. You can't really floss as easily underneath of it. And what ends up happening is it needs to be replaced at some point. So in the long run, actually, the bridge is actually more expensive than the dental implant.
So an implant, you just give them their tooth back with an implant.
Yeah, you know.
If somebody in your family was old enough and they were just missing 1 tooth,
Sure.
would you ever do a bridge if it was like somewhere in the front, or would you always do an implant?
If I could do an implant every single time, most definitely. Yes, no more bridges.
So the patients watching this that get bridges, is it just because they're afraid of the surgery, or
Yeah,
it makes sense? It seems like you'd want to get an implant over a bridge.
sometimes the barrier is surgery. Surgery is a scary thing. You know, I mean, that word
But
surgery
pain
is
is
a
not
scary
something
thing.
they complain about, you say, and they're all numbed up and sedated.
Yep, they're sedated, they're numb, and they're very surprised afterwards that they don't have a lot of discomfort or pain. Everybody's different, but the majority of our patients, they look at me like I'm crazy when I tell them that. And then afterwards, they always say, you know what, you're right. It's not bad at all. You know, in fact, we have some videos of patients who, on camera, they've said that, yeah, you know, it's no big deal. It's no problem. In fact, one of our patients, we did his full upper, full lower just very recently. He said, you know, slept like a baby that night. So you'd be surprised. These newer techniques and ways that we do things these days, it's a big change to what we're used to.